This guide is about a sickness called valley fever. It is an illness that people can get in certain parts of the world. These places are often dry and have dusty soil. Examples include parts of the southwestern United States and areas in Mexico and South America. We will look at why some people might get this sickness more easily than others. Older adults, perhaps those over 60 or 65 years old, seem to have a higher risk of getting valley fever. There are a few reasons why this might happen. As people get older, their bodies naturally change. One important change can happen to the immune system. The immune system is like the body's defense team. It works to fight off germs and sickness. In some older people, this defense team might not be as strong as it was when they were younger. This can make it harder for their bodies to fight infections like valley fever. Another reason is that many older adults live with other health conditions. They might have long-term problems such as heart disease, lung problems, or diabetes. Having these other conditions can sometimes make the body weaker. This weakness can also make it more difficult to handle a new sickness like valley fever. In the next chapters, we will explain more. We will learn exactly what valley fever is and how people get it. We will talk more about why age can make a difference. We will look simply at how the immune system works. We will also discuss how other sicknesses connect to valley fever. You will learn about the signs to look for and how doctors find the illness. Finally, we will offer some ideas for staying safer and managing health, especially for people living in or visiting areas where valley fever is found. This information aims to help you be aware and understand more about this condition. 2. What is valley fever? Valley fever is an illness. It is caused by something very small that lives in the ground. This tiny thing is a type of fungus. A fungus is a living thing, a bit like a tiny mushroom, but it lives deep in the soil. This special fungus has a long name, but we can just call it the valley fever fungus. It grows best in dirt, especially in places that are very dry. Where does this fungus live? It lives in the soil in hot, dry areas. These areas are often deserts. You can find this fungus in parts of the southwestern United States. States like Arizona, California, Nevada, New Mexico, Texas, and Utah have it. It also lives in parts of Mexico and even some places in Central and South America. The fungus makes tiny parts called spores. These spores are like tiny seeds and they are very light. People get valley fever when they breathe these tiny spores into their lungs. The spores get into the air when the soil is moved. This can happen when the wind blows dust around. It also happens when people dig in the dirt during farming or during building work. When the dust is in the air, people can breathe it in without knowing. This is how the sickness starts inside the body. It is very important to know that valley fever cannot pass from one person to another person. You cannot get sick by talking to someone who has valley fever or by touching them. It is not like a cold or the flu. You also cannot get it from pets like dogs or cats, even if they are sick. The only way to get valley fever is by breathing in the fungus spores directly from the dusty air. Many people who breathe in the spores never feel sick. Their body fights the fungus without them knowing. Other people might feel sick for a few weeks or months. They might feel like they have a bad cold or the flu. Common signs are a cough, a fever, headaches, and feeling very tired. For most people, the sickness goes away on its own, but sometimes it can cause more serious health problems. Understanding what causes valley fever helps people know how to be careful in areas where the fungus lives. 3. Why older people get sick more. As people get older, their bodies naturally change. These changes happen slowly over many years and they affect different parts of the body. One very important change happens to the immune system. The immune system is like the body's defense team. Its job is to find and fight sickness, like colds or the flu, caused by germs like bacteria and viruses. It works hard to keep you healthy. In many older adults, the immune system does not work as strongly as it did when they were younger. It can become weaker over time. This means it might be slower to notice germs when they enter the body. It might also take longer to start fighting the germs. When the immune system is weaker, it is easier for a person to get sick from infections. It can also be harder for the body to recover fully after being sick. This weaker immune system is a key reason why older adults have a higher chance of getting sick with valley fever if they breathe in the fungus. Their bodies might not be able to stop the fungus quickly or fight it off as effectively. Also, many older people live with other health problems. They might have long-term conditions like heart disease, lung problems such as asthma or COPD or diabetes. These are sometimes called chronic conditions. Having these other health problems can put extra stress on the body. They can sometimes make the immune system even weaker. Or these conditions can make the body less strong overall and less able to handle a new sickness. When an older person has a weaker immune system, and perhaps other health problems too, it makes it much harder for their body to fight valley fever. They might get sicker from the fungus compared to a younger person. These things, the changes in the immune system that come with age and having other chronic sicknesses, are important risk factors for older people getting valley fever and having more trouble with it. 4. How the body fights sickness. Your body has a special defense team to protect you from getting sick. This is called the immune system. Think of it like a team of guards and soldiers inside your body. These guards are always watching for harmful things, like tiny germs that can cause illness. Germs include bacteria, viruses, and fungi, such as the one that causes valley fever. When germs manage to get inside your body, perhaps through the air you breathe or a cut in your skin, the immune system guards spot them quickly. They recognize these germs as dangerous invaders that should not be there. As soon as invaders are found, the immune system sounds an alarm and starts to work very hard. Special cells in your blood, called white blood cells, are the main soldiers in this defense team. They travel through your blood to wherever the germs are. Some soldiers attack the germs directly to destroy them. Others make special weapons called antibodies. Antibodies are proteins that attach to the germs, making it easier for other soldier cells to find and kill them. Your body also has places like lymph nodes, which are like bases where these immune cells can gather and get ready to fight. Your skin is also a key part of the defense, acting like a strong wall to keep many germs out. As people get older, their immune system often changes. It might become a bit slower to notice the germs when they first enter. The soldier cells might not multiply as quickly or fight as powerfully as they did when the person was younger. This natural change is part of aging. When the immune system responds more slowly or is less strong, it gives germs a better chance to spread and cause sickness. This is one important reason why fighting off infections, including valley fever, can sometimes be more difficult for older adults. A defense system that is not at full strength means it might take longer to recover from illness, or the sickness could potentially become more serious. Knowing how your body protects itself helps explain why staying healthy is always important. 5. Other sicknesses and valley fever. Many older people live with health problems that last for a long time. These are often called chronic conditions. Some common examples are diabetes, where the body has trouble controlling blood sugar levels. Other people might have ongoing heart disease or problems with their lungs, like asthma or chronic obstructive pulmonary disease, also known as COPD. It is quite normal for older adults to manage one or more of these conditions daily. These long-term sicknesses can affect the whole body in different ways. One important effect is on the immune system. The immune system is your body's protection against germs and sickness. Chronic health problems can sometimes make this defense system weaker. This might happen because the body uses a lot of energy just managing the existing condition. Some medicines people take for chronic problems can also affect how well the immune system works. Also, some long-term illnesses cause ongoing inflammation, a kind of stress inside the body, which can tire out the immune system over time. When the immune system is not working at its full strength, it finds it harder to fight off new invaders like germs or fungi. This includes the fungus that causes valley fever. So if a person already has a condition like diabetes, heart failure, or lung disease, their body might struggle more against the valley fever infection if they breathe in the fungus. They could be more likely to develop symptoms. Having other health problems can also mean that valley fever becomes a more serious illness if a person does get sick. The sickness might last longer than it would in a healthier person. The symptoms, such as coughing, fever, and feeling very tired, could be much worse. In some cases, especially when the immune system is significantly weakened, the valley fever fungus can travel from the lungs to other parts of the body, like the skin, bones, or brain. This spread makes the illness much more difficult and dangerous. Therefore, managing existing health conditions well is very important for overall health and for reducing risks from infections like valley fever. 6. Signs of valley fever. When someone gets sick with valley fever, they might feel like they have the flu. The most common signs are feeling very tired, having a cough, and getting a fever. The cough can be dry or it might bring up some phlegm. People might also have headaches, muscle aches all over their body, or pain in their chest, especially when breathing deeply. Night sweats, where you sweat a lot during sleep, can also happen. Sometimes a red, spotty rash appears on the skin, often on the lower legs. These feelings usually start between 1 week and 3 weeks after breathing in the tiny fungus from the soil. Many people, maybe about 6 out of 10, who breathe in the fungus do not feel sick at all, or their signs are very small. For those who do feel sick, the sickness often goes away by itself after a few weeks or months. However, feeling tired can last much longer for some people, sometimes for many months. Because the signs are so similar to other common sicknesses like the flu or pneumonia, it can be difficult to know if someone has valley fever just by how they feel. Mistaking it for the flu can mean a delay in getting the right checks. This is especially true for older adults. Sometimes, older people might not have a high fever or their cough might not be very strong. They might just feel extra tired, lose interest in eating, lose weight without trying, or seem a little confused. These less clear signs can make it harder to guess the right sickness quickly. It is very important to see a doctor if you have these signs, especially if they do not get better after a week or two, or if they seem severe. Seeing a doctor is even more important if you live in or have traveled to places where the valley fever fungus lives in the ground. Be sure to tell your doctor about any travel. The doctor needs to know about your feelings and where you have been to think about valley fever. Getting the right help early is important, particularly if the sickness seems bad or lasts for a long time. 7. How doctors find valley fever. If you feel sick and think it might be valley fever, it is important to see a doctor. Go to the doctor's office or clinic. The doctor will talk with you and ask questions. They will want to know exactly how you feel. Tell the doctor about all your symptoms. Mention if you have a cough, a fever, chest pain, or feel very tired. It is very important to tell the doctor if you traveled recently. Did you visit areas like the southwestern United States, Mexico, or parts of South America? The fungus that causes valley fever lives in the soil in these places. Breathing in dust there can make you sick. This travel information is a big clue for the doctor. It helps them think about valley fever as a possible reason for your sickness. To check for valley fever, the doctor usually needs to do some tests. A blood test is very common. This test looks for special things in your blood called antibodies. Your body makes these antibodies to fight the valley fever fungus. Finding these antibodies can show if you have the infection. The doctor might also order a chest X-ray. An X-ray machine takes a picture of the inside of your chest. This picture can show if there are changes in your lungs caused by the fungus. Sometimes, doctors might test the mucus you cough up. They look closely to see if the fungus itself is there. Finding out if you have valley fever can sometimes take time. The symptoms often look like other common sicknesses like the flu or pneumonia, so it might not be clear right away what is making you sick. The first tests might not give a clear answer. You might need to do the tests again later. It is important to be patient during this process. Telling your doctor about your travel history is really helpful. It helps them find the correct reason for your illness faster. 8. Staying safe and living well. Living in areas where valley fever is found means you need to take steps to stay safe. The fungus that causes this sickness lives in the soil. When the soil is dry and dusty, the fungus can get into the air. Breathing this dust is how people get sick. One important way to lower your risk is to avoid breathing in dust. Try to stay inside during windy days and dust storms. Keep your windows and doors closed. Using good air filters in your house can help clean the indoor air. If you work outside or enjoy gardening, try not to do activities that make a lot of dust, especially when it is windy. Sometimes wearing a special mask can help if you must be in a very dusty place. Taking care of your overall health is also very important. If you have other health problems like diabetes or heart trouble, managing them well helps your body stay strong. When your body is stronger, it can fight infections better. Follow your doctor's advice for any health conditions you have. Eating healthy foods and getting enough rest helps your body too. Gentle movement each day can also help you feel well and keep your body ready to defend itself. Even if you are careful, you might still get sick. If you do get valley fever, remember that doctors have treatments. There are medicines that can help, especially if the sickness becomes serious. It is key to see your doctor early if you have symptoms that worry you. Living well in these areas means being aware. Know the signs of valley fever. If you feel sick with a cough, fever, or tiredness that lasts, tell your doctor. Also tell them if you live in or have visited an area where the fungus is common. This information helps your doctor find the problem faster. Being careful about dust and managing your health are the best ways to live safely.